He called Medicaid cuts morally wrong. Then he voted for them. Tonight, Senator Josh Hawley defends his flip-flop as health policy experts tell our political editor Mark Maxwell the math doesn't add up.
2 months ago, Senator Josh Hawley wrote it in black and white: don't cut Medicaid. Then he voted for the bill that does exactly that, arguing there's some gray area in how and when those cuts will occur.
You built something of a national soapbox, saying that cuts to Medicaid would be morally wrong, politically suicidal, and whether or not rural hospitals were forced to close now or later, this bill would eventually force their closure. How do you think voters in Missouri feel hearing you say all that and then vote for it anyways?
Well, I hope that they feel that and recognize they're going to get $1 billion more in rural hospital funding in the next 4 years because of our efforts. Missouri is actually going to see an increase of $1 billion for rural hospitals from now to the end of the decade because of this legislation, and specifically because of provisions that we got put into legislation.
But health policy experts say that oversimplifies and obscures what the bill actually does.
So when Josh Hawley is saying that he has brought home $1 billion to Missouri for rural hospitals, that is just, plainly not true. There's no guarantee that will be the slice of the pie that Missouri gets.
Emily G. used to work as an economist at the U.S. Department of Health and Human Services. She says each state will have to apply and meet strict criteria to qualify for those competitive nationwide funds. Nonpartisan analysts at the Congressional Budget Office projected the One Big Beautiful Bill Act would slash $1 trillion in federal Medicaid spending. What does that look like to Senator Hawley?
And we will see no benefit cuts whatsoever, again, because of compromise language we were able to win and get put into the bill.
So we asked his office to show us that language or his math. So far, we've seen neither. Recent research shows just the work requirements alone are likely to boot thousands of working Missourians off their health insurance.
I think it's not just possible, it's almost guaranteed that people are going to be losing benefits.
A 2019 study in the New England Journal of Medicine found that in 6 months when Arkansas tried it, researchers found a significant loss of Medicaid coverage and rise in the percentage of uninsured people. Quote, we found no significant changes in employment associated with the policy, and more than 95% of the people who were targeted by the policy already met the requirement or should have been exempt. In St. Louis, Mark Maxwell, 5 on your side.
In a statement, the president of the Illinois Health and Hospital Association said these cuts would, quote, force hospitals to reduce services, lay off staff, or close entirely. In the St. Louis metro area, more than 300,000 people depend on the Medicaid program, and tens of thousands could be expected to lose coverage.